And we have with us Shannon O'Hara. She's calling.
Hi.
Hey, all right. She's calling in from New York.
Hello.
And so Shannon is in the fashion apparel business. I'll let you explain. I know who you are. I don't want to give away too much, but what do you want to tell folks about what you're doing in New York?
Well, I mean, my normal job is that I am personally a tailor. I've been a tailor for 25 years, and I'm a highly specialized tailor. I normally work with fashion designers and stylists to dress celebrities and do high-end advertising. And my partner, my co-founder and I started last week. We're in all these industry chat groups like email chains, and in the entire fashion and entertainment business in New York, shut down because the governor you're not allowed to be running unless you're an essential group. So none of the factories that make apparel in New York are running. None of the tailors I know are working. None of the films are shooting. Everybody is at home, and we started seeing everybody on our email chat lines and so forth, just saying like, I have a home studio, I have a studio, I could be making masks. Let's all and we watched everybody trying to figure out how they could make 50, 100 masks in their home. And we just realized we have a giant pool of labor and every single stitcher, tailor, person I know has a full studio with professional industrial machinery in their home, and they could be making all these PPEs. Then to top that off, we also are connected to several factories that are not allowed to run, but they all have industrial cutting machines, and they could be cutting large scale PPEs, somebody in their home is physically with scissors cutting out, but these machines cut 250 layers of fabric at a time. So we estimate that if we put just the factories that we're working with currently and not reaching out to even more, if we put them to work, we could be cutting probably between 25 to 100,000 PPEs a week. Now in order to put ourselves to that, and we have the stitchers and tailors to do all that work. And right now we have a little over 500 professional tradesmen that were working in either the apparel industry or entertainment industry that are set up at home to do all the sewing. And the beauty of what we're doing is that no one is in the room together.
Right. And you're calling this the Skilled Laborers Brigade, right?
Yes, we do. That it's because really that we are a collection of factory owners and the actual people who sew garments. And I think that's important because there are a lot of people that are volunteering to make PPEs, and people that are making masks who are not industry professionals, and they're doing a wonderful job, and they're doing a great job making masks. But I just know the volume, where it may take a home sewer, let's say 20 minutes to make a mask, it would take a professional 2, so we can put, and not to mention what I said about the cutting machines.
Sure.
I can cut out 5,000 masks on one cutting machine in one day.
Now, what you're going to do is hospital gowns, if I believe that's correct, right?
I was just using masks as an example. We are in the process of speaking with mills about getting the medical grades fabrics.
I was going to say, where's the fabric coming from?
This is the big issue that everyone's having, and why these PPEs aren't being flooded into the market really quickly, is that a mill that's making medical grade fabric is not something that somebody from the public can contact. You have to buy massive amounts of fabric at once. So you can't, which is fine because we need massive amounts to cut out our potential. But the other issue that we're having, why we're in the situation we're in globally, is because we made a choice a couple decades ago to make all these medical gear out of disposable fabric. So the mills haven't been making that much launderable fabric. So, and that's what we need to be using now. Like in order to make gear in a non-sterile set up giant factory, you have to be able to wash it to sterilize it. So everybody now wants launderable masks and gowns, and you can't buy that unless you're buying large amounts. So we're talking to hospitals, and we're talking to governmental agencies about trying to get that going. But in the meantime, you know, none of the people I'm working with want to sit idle. So, I mean, we're cutting out 5,000 masks today that my stitchers are going to be getting tomorrow, and they're going to be working on, you know, so we're working. It's just, I'm very frustrated that we're not working to our full potential, which could.
Yeah, you could scale up if you had the raw material. Yeah.
And, you know, 5,000 is an impressive number, but 100,000 is a more impressive number.
Yep.
So now, is there any way, we're in Michigan, obviously, is there any way for folks like you in Michigan, I'm sure we have them here in the Detroit area, because we have a bit of an entertainment industry here. Is there any way for them to work with you?
Oh, definitely. We are, one of the things that, like, I won't go into the nuts and bolts of the production process we've made up, but we have specifically, it isn't as simple as just like picking up the cutout mask or gown and dropping it off. We are working with another organization to set up like virtual quality control and safety control. So like they're developing a QR code for us so that we can constantly be in monitoring of what they're making and that they're making it safely. And this is all done remotely, you know, and we have people that have signed that are part of our ranks that are professionals in different parts, you know, outside of New York City. I mean, a lot of them are New York City just because that's the people I'm personally connected to, but we could for sure do this nationally. Not to mention, if anybody across the country wants to order from us, like the mail is still running in New York. You know, there's no reason we can order fabric. I think we are in the middle of ordering fabrics, like additional fabrics. We're finding we can get a fabric within a couple days. It takes a couple days to cut and sew. Like you could get it in under a week, probably.
Now, New York is certainly one of the epicenters in America right now of the pandemic. So initially, on the stuff that you're creating, PPEs, and we should define that term. That's.
Oh, okay. Sorry.
Go ahead and define the term for the audience.
I've been steeped in phone calls with politicians, and everyone's just saying PPE. That stands for personal protective equipment. So what that is everything that the hospitals are running out of: isolation gowns, protective coveralls, face masks, booties, headgear, like the things that protect a nurse or a doctor from getting sick. And the other thing that we have been getting, I would say a majority of the people contacting us for help have not necessarily been ER rooms. It's been, you know, who we're cutting out for today is a group of OBGYNs who don't have masks for labor and delivery. Uh-huh. And, you know, or we're making masks for a large group of firemen. You've got fire, police. What about the people that are in prisons? What about the large grocery store chains? You know, like there are, honestly, the research I've been reading, they're showing that South Korea it has a much slower infection rate, and that government requires every single person to be wearing a mask when they go out in public. So, I mean, we potentially could be making for just your next door neighbor.
Right.
Right, exactly. Yeah, they have flattened the curve. We have not yet. So.
Yeah, I mean, I'm afraid that New York may be a little past the curve.
Yeah.
Well, that hospital ship just arrived today just to take the normal patients so all the New York hospitals could focus on the COVID-19 patients. So it'll be interesting to see how that all works out.
Yeah, here in Detroit, they're setting up the convention center as an overflow hospital just for the COVID-19 patients. So,
Wow. Yeah, I mean, I've been following a little bit of Michigan just because I have family there. The news just comes at you, a mile a minute.
Yeah, absolutely. So and we want to keep you on, we're going to have Fred Brown on for the third segment, and I think the two of you could discuss these things together. But if people want to reach out to you, they want to participate in your skilled labor brigade, I can do it. How would they do that? So,
well, we've set up a website. I have to say, we've done all this in 6 days. We've put together a 500 employee plus, or employee/volunteer plus manufacturing production line in less than a week. And so, we also set up a website so people can contact us. It's skilledlaborersbrigade.com.
Okay.
And if you would like to join our ranks as a craftsman who is a skilled laborer, we have a page for that. If you would like to donate so that we can, for these projects that we're trying to just do large scale cutting for, we have a /donate page. And if you also are interested in amplifying your production process, like there's plenty of people that, designers and people that are making their own efforts with, their 10 employees. Well, if you want to amplify that, we can add 10 or 500 employees to your process.
Traditional four-year students love Lawrence Technological University's thriving campus life, but LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.